sir, I am Jamala Kim S. Albis, your student nurse from Camarines Sur Polytechnic Colleges. So for today, I am going to demonstrate withdrawing medication from the Vial. So before going to the procedures, we will ensure that we follow the administering medication. So these are the right medication, the right dosage, the right route, the right time at the right patient. Then next, we can go now for the preparation. So first, we need to assemble the equipment and the supplies. So I already gathered and prepared the necessary equipment that I am going to use later on the procedure. So these are the MAR, the
Vial.
patient, the safety needle or the syringe, filter needle, antiseptic wipes, but I am going to use is the cotton with alcohol. Then the gloves. Then next implement the same preparation described in skills by preparing the medications from the ampule. So first, we need to check the label of the ampule against the AMR to make sure the correct medication of the patient is being prepared. Okay, I already done checking. Then we can go now for the procedure. So first, perform the hand hygiene. So okay, before I came here, I already performed the hand hygiene to prevent the transmission of microorganisms from one patient to another and to maintain the cleanliness of the table and the way I am performed the medication procedures. Then I already observed the appropriate infection prevention control procedures. Then next, prepare the medication vial for drug withdrawal. So mix the solution if necessary by rubbing the vial between the palms of the hand, not by shaking. So simply rubbing the solution. Then we can now wear or put on now the gloves. Then remove the protective cup or clean the rubber cup with an antiseptic wipe by rubbing it in a circular motion. And discard it to the ship disposal. Then next, withdraw the medication. So attach the filter needle to the syringe. Attach the filter needle. Ensure that the needle is firmly attached to the syringe. And remove the cap of the needle, then draw up into the syringe the amount of air equal volume of the medication to be withdrawn. And we will need 80 ml antibiotics of medication, so we will withdraw the air with the same amount of medication. Okay, this is already the 3 ml. Then invert the air into the vial by keeping the level of the needle above the surface medications. Then withdraw the air the prescribed amount of medication. Then withdraw the prescribed amount of medication. So there are two methods, but I am going to invert the vial to ensure that the needle tip is below the fluid level and gradually withdraw the medication. So hold the syringe and the vial to determine the correct dosage of the drug is drawn into the syringe. Then eject the air remaining at the top of the syringe of the vial. When the correct volume medication is plus a little more, then we can add 0.25 is obtained. Then withdraw the air from the vial and replace the cap over the needle using this scoop method to maintain its sterility. So do not touch or hold the needle to maintain its sterility. Then, if necessary, tap the syringe barrel to dislodge any air bubbles present in the syringe. Then next, if giving an injection, replace the filter needle if used with a regular or safety needle with the correct gauge and length. So remove the filter needle and replace with a safety needle or the regular needle. Then verify the correct medication volume. And verify the correct medication volume. Preparing and using the multi-dose vials and read the manufacturer's directions and withdraw the equivalent amount of air from the vial and adding the detergent use unless it is otherwise indicated by the directions, and add an amount of sterile water or the saline indicated in the directions. And if the multi-dose is reconstituted, label the vial with the date, time, and when it is prepared, and the amount of drug is contained in each milliliter of solution, and your initials. So once the medication is reconstituted, store it in a refrigerator or as recommended by the manufacturers. Then next, dispose all the supplies appropriately, replenish the top, and return the client to proper place, and discard the use of disposal supplies. So that concludes my demonstration in withdrawing medication from the vial.